Hello, Miss Smith. It's Kathleen. The nurse asked me to come in and assist you with bedpan, okay? I'm going to get the equipment we need and we'll get started, okay? First, we're going to provide privacy. Okay, so we provided privacy. Now I want to make sure that you see that the equipment that you're going to use for this skill, you have your hand wipes, you have tissue. Notice that you have 2 pair of gloves for this skill because we'll be demonstrating removing of gloves twice as well as hand washing twice. One of the things that's very important is the critical step in this skill. Number 5 is your critical step, and that's the placement of the bedpan. What you want to remember, this is considered a regular bedpan. The wide end always faces the head of the bed. If you have it this way, you have it incorrectly, and that's not good. This can cause a lower back injury, and so we want to make sure that that doesn't happen to our patients. Safety is very important. So again, you want to remember that. All right, now we're going to start the skill, okay? Now, one of the first things, again, you want to do prior to placing the bedpan is put your gloves on. Now, in this skill, Miss Smith is alert and oriented, so she's able to assist us. Some of your patients couldn't lift up like she's able to, so we would be turning them on their side to place the bedpan. But in this scenario, she's able to rise up for us, so she'll be able to help us. You want to maintain complete privacy of your patient at all times. Now, Miss Smith, what I want you to do is bend your knees for me and plant your feet flat on the bed. There you go. Thank you. We're going to go up under the sheet here, and we're going to place the bedpan up under her on her buttocks. On the count of 3, you want to lift up for me. We like to do things in 3s to let our patients know when to move and that kind of thing. So on the count of 3, if you'll lift up for me, 1, 2, 3. Now you have to check to make sure that your patient is right on that bedpan correct. All right, is that comfortable for you? You can relax your legs for me, okay? Now, also notice in the steps, as you see them going up on the screen there, it says that the head of the bed must be flat. So in the beginning, you want to definitely make sure, and of course hers was. Now, prior to actually letting the head of the bed up, here's a specific point that you want to make sure you do. Remove these gloves at this time. So you'll take these gloves off, you will throw them away. And you'll say, I'd wash my hands. In reality, you would actually wash your hands. Now, at this point is when you would actually raise the head of the bed for the comfort of the patient. And you're going to ask Miss Smith to tell you when she's comfortable. Miss Smith, I'm going to let your head up, okay? You tell me when to stop. Is that comfortable? Okay. All right. Now what you have to do is actually bring the tissue and the wipes over by your patient. Now in this scenario, Miss Smith can actually wipe herself, so you want to make sure that it's in reach. One of the things that's real important, one of the steps tell you not only do you give them the hand wipes, but you have to give them instructions on what to do with the hand wipes. And if you don't do that, you'll get a no for that step. Miss Smith, here's your tissue, so when you're done, just wipe yourself, okay? Right here are your hand wipes. When you're done, I want you to wipe your hands really good, and there's a trash can right here. Okay. Now, in reality, sometimes you're going to have to actually help your patients clean themselves up. But in this scenario, for testing, they're able to do all that themselves. Miss Smith, here's your call signal. I'm going to step right outside your curtain to give you some privacy. And when you're done, you just hit that button, and I'll come back in and assist you getting straightened back up. Okay. So you're going to step outside the curtain at this time.
I'm ready.
Okay, we're going to come back in. Make sure you close those curtains back. Now, one of the things you want to do is put on a new pair of gloves prior to doing anything in assisting her with getting off the bedpan. So we're going to put our gloves on. We're going to move the table out of the way. The step also, it tells you before you remove the bedpan, there's another before in there, you want to let the head of the bed down. You always want to make sure the head of the bed's down because you're removing a bedpan, so you're going against gravity if you don't. You only need one mistake with the bedpan to know, and you always remember to let the head down. I promise you. I'm going to move your cowbell just for a second. I'll give that back to you before I leave you. Okay, at this time, if you would bend your knees for me. There you go. On a count of 3, I want you to lift up, and I'm going to take the bedpan out, okay? 1, 2, 3. Thank you, and you can relax your legs. Now this time I'm going to go over to the bedside commode to empty this out. So I want you to follow me as we continue the steps. Okay, at this time, you're going to simulate like you're emptying out the bedpan. And remember, they're going to have the bedside commode there for you. Wherever you see that sign that says toilet, that's what you want to utilize. Then you're going to rinse your bedpan. It tells you to rinse your bedpan and pour into the toilet. Do not pour this in the sink because you'll get a no for this step, okay? So you want to pour it, okay? At this point, we're going to wipe it out and dry it out. Many of your facilities, when you go to work, they have hoppers that you can utilize to rinse it out. Now it tells you to place it in the designated dirty supply area. Okay, so you'll do that. Once you've done that, you're going to remove your gloves. You would wash your hands. Now we're going to go back over to our patient, make sure she's comfortable and in a safe position. All right, Ms. Smith, you okay? Mm-hmm. All right. Let me give you your call signal. You just give us a call if you need us, okay? All right. We'll put away our supplies, and at this time the skill is complete.